YouTube channel for any students unable to see it or want to review it with you.
All right. Well, so welcome everybody to this Health Industries Week alumni panel. Thank you to the Center for Career and Experiential Education. My name is Marian Manuel. I am an assistant professor here at the University of Rhode Island. And today we're going to have some neuroscience alumni who are gonna tell us about their trajectory and their current work. So maybe we could start by just having each of them introduce themselves with just their name and pronouns if they want, and what their title is right now, and then we can dig into some more questions. So I don't know. Let's start with Anya.
Hey, I'm Anya. My pronouns are she, her, hers. I am a graduate student at the University of Miami, actually in cancer biology, so I kind of switched gears a little bit. I am about 6 months from graduation, so I've been at the University of Miami for almost 4.5 years now, and yeah, wrapping up my time in cancer biology there.
Great, congratulations. Sarah, Spini.
Hi, my name's Sarah. I just recently graduated from the University of Rhode Island, and I'm currently working as an emergency medical technician for Boston Emergency Medical Services, as well as I'm currently in the application process for PA school.
Awesome. Jewel.
Hi everyone, my name is Jewel. I graduated in 22. I'm currently an MD PhD student at UMass Chan Medical School, finishing my second year.
Paige.
Hi, my name is Paige. I graduated from the University of Rhode Island this past December, and I currently work as an executive clinical medical assistant at Rizzuto Eyelid and Facial Plastic Surgery.
And Sarah, the other Sarah.
Hi everyone, my name is Sarah. I graduated in 2024 and I'm working as a surgical neurophysiologist for accurate neural monitoring. I'll also be starting PA school this June.
So welcome all. So maybe each of you can briefly tell us about your journey since graduating from URI, how it was to get a job and or get into graduate school, and what step led you to where you are now. So briefly, maybe same order. Let's start with Danielle.
I came straight from URI to UMiami. I actually spent my senior year at URI doing my grad school apps. So if you are looking into doing grad school, PhD or MD, and you're not looking to take a gap year, you should be spending quite a bit of time your senior year getting those apps out. So I'd say that was my whole journey. I haven't done really anything in between.
Hmm.
Hi, so I just finished, I graduated in December, and I knew going into this upcoming spring that I'd be applying to PA school. So that's been something that's been on my radar. So a lot of applying to jobs, because when you're applying to PA school at the time I am, you're going to be a year into graduation essentially before you're even considering starting PA school. So a lot of applying to jobs. I was an EMT for URI, so I kind of fell into a position here in Boston, which is my hometown. But yeah, just apply for PA school and work because it's hard.
Hmm. Joe.
Yeah, so I had some research experience in undergrad, but I took 2 gap years to basically study for the MCAT and then also get some more research experience. And then through that technician position at Boston Children's, I was able to apply to schools and interview and it took like a whole year process. So it was good to have that kind of separate time from school.
And I graduated in December, but I knew that I wanted to go to a graduate program. So around March of last year, I started looking for jobs to get patient care hours because it's definitely very important for graduate programs. So I started applying. I used Handshake and I got a job at Rizzuto Island and Facial Plastic Surgery where I am now. So I've been working full time for almost a year. And I'll also be applying to PA school this semester or this term.
Sarah?
So after graduating in May, I started working as a medical assistant in dermatology. I did that for about 6 months, and then I applied as a surgical neurophysiologist. It was a trainee position, and I was trained on the job. I've been there for about a year now. During that time, I was getting my application ready for PA school, and I was accepted this August, so I'll be starting in June.
Awesome. Congratulations.
Thank you.
So, do any of you have any insight on how you chose your career path? Like, is there like something that happened during your time, maybe at URI or elsewhere, where you decided of where what you wanted to do in the future? Any of you?
I can start with that one. I actually originally was pre-med thinking that I was gonna get my MD, but I joined it was Brian Dewsbury's class. He no longer teaches there, but he told me that I should apply to the Mark U Star program, which I believe also no longer exists, but
Hmm.
it was a research trainee program in which I was able to join a lab my sophomore year. And get some research experience. And it was actually him who told me that I should consider a PhD. So I guess my advice to you all would be to really play to your strengths and listen to what people around you have to say. Like, I was so set on MD, but now looking back, I really would not have thrived in that environment. So if you have professors that are telling you, oh, you're really good at this, or oh, you're good at that, you should try to take that advice and see if you can open up other paths that may or may not be what you had considered previously. So that's how I switched to PhD from being on the MD track.
Great. So yeah, you're right that I think the Mark U Star does not exist anymore, but we do have the Esteem program and we have the summer program SURF, where students can apply to have research experience over the summer. So keep that in mind. Anybody else?
Quickly just going off of Anya, because we had a similar like pathway being within Mark. And you mentioned the summer programs, and I feel like that helped me a lot too. Especially with figuring out, if I also want to continue like the MD path. URI didn't have an associated medical school. So being able to do summer programs away, working under MD PhDs or just being on a campus that has like a medical affiliation, really helped me figure out if that was something I wanted.
Mhm.
I also think that research is super important. I had a similar but somewhat opposite experience where coming into neuroscience, the neuroscience program, I was really enthralled by research, and it was something that I really wanted to go into. And I did it and I enjoyed it and I loved my program that I worked with. But I kind of came to the conclusion that maybe research wasn't the field for me for a long-term career path. And so I kind of on a whim joined URI EMS and I ended up working now as an EMT. I was able to get my patient care hours that I'll need for PA school, and I kind of found um, a passion for working in like a more clinical setting, which again, like I said like joining things, doing research, applying to things, even if you're not sure if that's what you want to do, is always a really great opportunity because you might get something that you're not expecting, and it can lead you in a different path. So being open always.
Okay, thank you. Okay, so moving on. Maybe do any of you want to like talk about like what's a typical day for you? Like what do you find most rewarding, most challenging about your work, and like what do you do in your role?
I can talk about my day. Um, so a surgical neurophysiologist, we're responsible for monitoring the nervous system during surgeries. So I typically arrive to the hospital like an hour before the surgery starts, and I'll start setting up the OR room with my equipment and speak to the patient, get consent for neuromonitoring. Once the patient's in the room, we apply electrodes to the muscles and to the head of the patient, and this allows us to run different types of tests to monitor the sensory and motor pathways of the nervous system. This is all done throughout the surgery, so we're able to communicate in real time to the surgeon if there's any changes throughout the surgery.
Nice. And those are patients that are undergoing what kind of surgery generally?
We mostly do spine surgeries, like for herniated discs or fusions. We also do thyroid surgeries where we monitor the vagus nerve, um, and also cranial surgeries, but that's more advanced and for people further along in their career.
Hmm. And what do you find the most challenging in your day-to-day life?
I would say it's pretty challenging working with some surgeons have more difficult personalities than others. So just kind of balancing that, navigating how to work with different types of people. Um,
Hmm.
yeah.
I can kind of add on to that. I'll go in the opposite order. I think the most challenging part of my day is definitely working with other people. I think you'll find as you get higher up into the sciences that a lot of people um, just generally don't have the same like appreciation for social interaction as you'll find in undergrad. But once you get up to like the surgical, the PhD, the MD level, you'll find quite a few challenging people to work with. I actually went to a workshop on Friday called How to Work with Difficult People that my school offered, which I thought was really funny because it was very crowded and everyone was there trying to figure out how to work with all these people that they don't like. But that was the most challenging part for me. But I'll say what a typical day in my experience looks like is it's different every day. As a graduate student, I make my own schedule. So, for example, some days I go into work and I'm running Western blot after Western blot. I'm sure some of you are familiar with those, or I'll be running like flow cytometry or running an ELISA, all kinds of like wet lab experiments. But then the next day I might choose, oh, I'm going to work from the library today and I'm going to analyze my data. I'm going to write my manuscript. I'm not going to show up to lab at all, actually, because of the difficult people. And I'm going to work in peace at the library on my manuscript. And so, as a graduate student, you really do, if you're in a lab that offers you that flexibility, you really do get to make your own schedule and kind of work at your own pace, which is very nice. And I'd say that that's the most rewarding part of my day is like getting to accomplish what I put on my to-do list because I make my own to-do list and then I get to do kind of what I want for the day in terms of as long as I'm being productive and getting things done.
Hmm. Very true. Anybody else?
Yeah, so at my job, I work as a clinical and medical assistant. So on Mondays and Tuesdays and occasional Fridays, we see patients. So a lot of what we specialize in is ophthalmology, so eyes. And we see up to 50 patients on Mondays and Tuesdays. And then Wednesdays and Thursdays, we operate. So I'm also his first surgical assistant in surgery. So I'm very lucky to have the job that I have. I think that it's opened my eyes to a lot. I've been able to get a lot of experience in the past year that I didn't think possible. I learned a lot more than I thought I would. So I'm very lucky for that. It's rewarding to see the patients after surgery, how nervous they are before, and just having them have their health restored afterwards. But in the same breath, it's also challenging just juggling all of the administrative tasks because I also do a lot of paperwork, a lot of behind the scenes things. So it's a good mix, and I'm very grateful to have the opportunity that I have to learn.
Wonderful. Sarah, Jewel, you wanna?
I will say my position working as an EMT is very dynamic to say the least. I'm encountering a wide variety of patients, populations, medical problems, issues, things that arise. I work with patients who have respiratory illnesses, cardiac diseases, allergic reactions. I work from patients that are 100 years old to babies. So it's definitely a wide range. You see something new, you never know what you're going to get called to, when you're going to get called. Doesn't leave much time for the paperwork aspect of it, which is there regardless of what it may appear running around in a ambulance all day. But it is a very interesting job. It is a very rewarding job. Being there for someone on potentially the worst day of their life, in an immediate and emergent situation can be difficult, emotionally for you, for your patients and whatnot. So it's really a rewarding job in a sense where I can help people. But it can also be challenging because outcomes are not always necessarily what you might expect or want. And you see people living in difficult situations, especially in the city. So it's definitely opened my eyes to a lot. I've experienced populations that I never thought I would deal with. Um, and yeah, it's a really interesting job. So I encourage you, if you're doing patient care hours, to think of EMT. It's not always everyone's number one choice or idea, but it's a really cool job.
Thank you.
Um, I'm basically like back in school, it feels like. So like, classes, exams, there's not really much to say except that it's just a little bit harder than undergrad classes. I think it's a bit more free time, although my undergrad years were mostly during COVID, so it's kind of like Zoom or like classes were canceled more often. Kind of feels similar to that now, where you don't really have to go in person if you don't want to. Things are recorded a lot. So you just have to keep up with it more on your own, compared to undergrad, which is nice because I get to, maybe do fun things that with more free time, but also work on my extracurriculars more often.
So, Joe, I don't know if you have an insight on this because I mean, you're early in your journey and you don't know what the other side is, but do you know what the difference between an MD, PhD and a classic PhD would be? Like, so in your experience, like what kind of things do you do compared to Anya, for example, works in a wet lab. It does like some bench experiments.
So I also work in wet lab. My PhD will be in basic sciences, looking at apoptotic systems, in bacteria and eukaryotic cells. So that's kind of one path that I took. Some people do more of the like public health sector
Hmm.
research where, they're using like exclusively uh, social determinants of health data or fully clinical data and use that for their research. I really like the lab and bench work and looking at like cells microscopically. So that's where I will go into. maybe
Okay.
my clinic won't really align exclusively with that. But that's always okay. There's lots of opportunities you can take with having both degrees, especially like the idea is having that exclusive PhD time to be able to work on like answering fundamental questions and research that an MD alone wouldn't have that exclusive like mentorship to be able to learn from.
Hmm. Great. Thank you for that. Okay, so I guess in the same related vein, like what kind of experience or skills that you learned during your undergrad, like you thought was really instrumental in like getting your position, or like something that you think like is really useful for a student to have when they are looking for a job or when they are trying to get into grad school?
If
Anything comes to
grad
mind?
school is the goal, I'd say for me, there were three skills that really stood out above the rest. The first was being able to interview well. So if you are someone who tends to freeze or get nervous or any of that during like talking to new people, I would really ultimately encourage you to work on practicing those interview skills with a peer, a professor, anyone who you can find who might be able to help you with that because grad school takes they take so much time to interview you before they accept you. I went through multiple rounds of interview for each school that I was applying to, and at the end of the day, if that's not a skill you're strong in, they will definitely drill into you with questions of like if you start to falter or like get nervous, like they will exploit that. At least in my experience is how it was. The second thing I would say is we are in the age of AI, so I would ultimately encourage you learn those skills of how to code, how to use all these new tools, because they're definitely going to pop up in your grad school experience. And the last thing I wanted to say is time management. In graduate school, you don't necessarily have someone breathing down your back saying, get this done, get this done. The deadline's Friday, the deadline is Monday. You just, it's a 4 or 5 year project with one deadline, and that deadline is graduation. So if you can't keep yourself on pace, if you can't work on your own, it really might not be the path for you unless you can get those time management skills a little bit up to par.
Mhm.
For my job at least, I think that something that was very fundamental in getting the job and just learning about patients was actually working in a lab undergraduate. So I worked in Nicole Logan's lab. We did a lot of work with pediatric patients and just getting the basics down, learning to work with families, learning to administer tasks and different types of tests was instrumental in me figuring out how to speak to people, how to be professional and just learning how to like she was saying time management just to schedule everything so it runs smoothly and to just make sure that everyone is happy, healthy, and cared for adequately.
Anybody else? Okay, so maybe another way to phrase a similar question is like, do you see any like things changing? I mean, I know you're still early in your career, but do you see anything like that's really changing? Like Anya mentioned AI, for example. So are there like some trends that you see emerging that students should be aware of if they want to go into that career, and things that they should get ahead of?
I think one of the most important things for like applications for grad programs is kind of having like a story a strong reasoning of why you want to go into that specific field. And a lot of the things that I see for like interviews, are people, they don't kind of just check off things on a checklist. They have reasonings for why they did each individual activity that they kind of threw on their resume. And it looks really, really good when it creates that type of story of like, I did all these things and that helped me solidify my reasoning to go into this field. And that's
Hmm.
one of the things I see that are changing, being on like two interview groups so far, is that people are kind of making their stories more flawless over time. And things are getting a little bit more competitive also because of that. But just from an early beginning, kind of thinking about what you want to do and doing activities that help you really figure that out can help lead to like that story.
To add to that, I know that PA programs are getting increasingly competitive. So having those experiences and also explaining why they will make you a good provider or a better provider, for anyone who's interested in applying to PA school, how each experience affected you and made you grow as a person.
I don't know if this answers the question that was asked, but to add on to what Jewel said about kind of curating a story, I read this quote somewhere that was like, graduate schools are not looking for a well-rounded individual, they're looking for a well-rounded student body. So if you can kind of less spread yourself out between soccer and research and sorority and whatever else it may be. Like all those things are great, but if you can find a way to connect them and make yourself like, for me, it was I was director of academic affairs in my sorority, and I did like advising help with the academic advisors. Like that was my thing. I was just like very direct in what I wanted to pursue. And so, like, to connect all of those things and tell a story about who you are as a person, if you can stand out in one particular way, I think that's where the field is trending in terms of like getting a well-rounded student body, not like a spread out, well-rounded individual.
Thank you, Daniel. Um, Anybody else want to say something about like do you see any changes, any things that you think are going to be the future of your profession?
I think a different part of my job is also scribing, and it's becoming definitely increasingly more AI used. So a lot of AI, different types of software can scribe for medical physicians. So I think it's just important to one, understand the importance of how you can utilize that in your everyday life and how you can work with AI. And then also, I think that it's just important to have good writing skills because a lot of the times you will be compared to different forms of AI and AI software nowadays.
Hmm. Very true. Mhm. Okay, so I want to leave some questions, some times for the questions from the students. So to get us primed for this, like, is there like one thing, if you could have told yourself one thing before you graduated, to prepare yourself for the future, what would you have told yourself, like knowing that you what you know now?
Uh,
Let's start with Anya, maybe. Let's go in order.
Jewel unmuted. Let's toss the
All
mic to
right,
her.
fine.
Um, I think I kind of like had an idea that I wanted to go to grad school right when I graduated. So, I started thinking about the MCAT really early on and starting to kind of rush myself. But, I didn't matriculate for like 2 years after I graduated, and it's all fine and it works out great. And that's a lot of people's paths too. So I think it's okay to, have a high standard for yourself and push yourself, but at the same time, take your time, and life's not going anywhere without you. And school will always be there, or job will be there. So it's important to kind of make yourself the best you can be, and not to rush things on too early.
Wonderful advice. Thank you, Jill. All right, Anya, your turn now.
Okay. I'd say I kind of have two things that I can't decide which one is more important, but the first is to take care of your mental health above all else, because if you cannot take care of yourself, you cannot do anything else. I definitely burnt myself out to the point where I was like not even wanting to do school anymore when I was finishing up my undergrad, and then I started grad school like in a really bad place because I was already so tired and I had no time in between. But ultimately, like, if you can take care of your mental health, you can be prepared for anything. And then the second thing, I couldn't decide what to say, but um, I'd say if you're not 100% sure that you want to do this, take some time off and like get some other experiences, because a PhD or an MD PhD or even an MD is 4 or 5, even 8 years of like a complete grind. Like, it is very tiring. It's very challenging. And if you're not like, this is something I want to do for myself, if you have external validation coming towards you saying, oh, I think my mom wants me to do this, maybe don't do it. You need to be really sure because it is a lot.
Sarah S.
What I will say, and I do find myself falling into it myself as well, is comparison. We are in a very competitive field. We're all going into very competitive careers, very likely. And it is very easy to compare yourself to others, compare your timeline, compare your grades, compare your extracurriculars. Um, and like Anya said, schools are looking for a well-rounded student body. They're not looking for robots. They're not looking for everyone to be the exact same and have the exact same GPA. And although you want to hold yourself to a high standard, and make yourself as competitive as an applicant as you can, it is really important not to compare yourself to those people around you because you will end up tearing yourself down, and your mental health will likely suffer. Some people strive under that, but others, can have that be a little bit of a fall point. So try your best not to do that. I know it's difficult, but
Very good advice. Thank you. Paige?
I definitely agree with that. And I think going off of it, just kind of slow down, shadow different specialties, take your time. A lot of people our age or our majors, we all know we want to do something in the medical field. So if you are really passionate about it, I'm a firm believer that it will happen. It might not happen on the timeline that you expect, but it will. So in the meantime, just kind of slow down, get your groundings, and just shadow different specialties, see what you really like so you don't regret anything in the future.
Good. And Sarah?
I would say that my piece of advice would be to try different things and don't be scared to try different things because you might find that you like something more than you had thought you would. When I was graduating, I never would have thought I would be working in an operating room right now, but it's all stepping stones and you'll end up where you're supposed to be.
Wonderful. Thank you so much, guys. Okay, so yeah, so let's open it for questions. I'm sure our students have lots of questions to ask or some advice to seek. So now's the time. So
Dr. Manuel, if I could just jump in quickly
of
before
course.
we open it up for students, I just want to
Hi,
say
Lisa.
hi everyone. I'm the director of the INP, and I just wanted to say how proud I am of the panelists. It's amazing what you've done with your careers, and it's so great to see all of you. And for the student turnout today, it's really impressive. So thank all of you for signing on. The last thing I wanted to say is not everyone in neuroscience, you've heard me say this if you've had classes with me, not everyone needs to go on for a PhD or an MD or PA school or, even an accelerated bachelor's to nursing, master's nursing program, anything like that. There are other options in neuroscience. We really need neuroscientists in industry, working for pharmaceutical companies. We need neuroscience writers. There's a lot of different things you can do with your undergraduate degree. So thank you again to the panelists, and I'm looking forward to hearing the questions.
Mhm. Thank you, Lisa. You're absolutely right. There's we could use some more neuroscientists everywhere. So yeah, if you have some questions, I can't see everybody on my screen, so like unmute yourself and or raise your hand, whatever you need to. Um, yeah, Noah, let's get started with you.
How do you guys feel about gatekeeping in the medical community?
Yeah, do you mean like when it comes to like applications?
Yeah, just anything like systematic barriers.
Yeah. So I came from neither of my parents went to college. I was the first, technically, yeah, like first generation college student. So it was hard to kind of find information about like what I'm supposed to do and things like that. And like especially when you're an undergrad, you're already like feel like you're on a time crunch and have to get stuff done. It was good when I was in the MARC program and they have similar programs that was mentioned, where you can kind of almost have like an assigned mentor to you that can help lead you in the way. Honestly, I learned a lot online, trying to figure out and then asking more questions online and getting information that way. I think mentorship is really important, especially if you can kind of pinpoint somebody who had a similar path. And that doesn't mean they have to be like a 6-year-old professor and whatever. I mean, a mentor could still be like a current graduate student that you connected with, that went to URI and, can give you advice. I think even for applications, usually somebody who's more closer to that time point is gonna help you out a lot more. Yeah, so in the medical field, people, they compare themselves to others and they don't want to give people hints a lot of the time on like how to get to a certain place. But that doesn't mean everybody's like that, and it's important to kind of find your people that will help support you.
Anybody else? Jenna.
Hi, sorry. I just got off the bus, so I'm kind of walking right now, but I was wondering more. I don't remember your name, I'm sorry, but your career for a neurophysiologist. Is how you reached out and how you built to where you are today, I guess, if that makes sense.
Hang on, Jenna, you were cutting off, I think, a little bit.
Hello?
Yeah, can you repeat your question, please, Jenna?
Yes, I can. I was wondering more about the career about the neurophysiologist and how you got where you are, the networking opportunities, and like yeah, so like the steps of how you got where you are, if that makes sense.
Yeah, so uh, it was actually through networking that I got the job. My dad's friend worked in the field, and his friend was actually the education director of that company. So he was responsible for training all of the new members and new employees. So on a whim, I had a phone call with him, and he was telling me about the career. And he said, "Hey, you might want to apply. I think they're hiring." And I did that and I got an interview and it worked out. So, networking is great. You never know what a phone call and where it can take you.
Thank you. I appreciate it.
Yeah. So one thing I was wondering is, so for example, Paige mentioned that writing skills are remain important in even in the age of AI, and like, but maybe you went into science because, oh, you don't like writing, right? That's often the dichotomy. So is there like one like a skills that you thought, oh, you never used, that you, I don't know, you learned in school or something, you thought you never used that, and then suddenly you realize how big of an impact it has in your day-to-day life?
For me specifically, I do think that just some writing classes really did have a lot of impact on how I just look at different things too, as well as specifically like research. I think that I've had a couple different research opportunities and bringing that to the job that I have now. Like Sarah was saying too, it's very important for networking because I was able to get some on some different papers or work on some publishing things. And all of that was because I was able to network and I was able to have some writing skills and just my science background in lab. You can kind of tie it all together and use it to your advantage. And I think it can really make you more well rounded and just also give you different things for your resume, but also just learn a lot more. I've learned a lot through research and then a lot through patient care experience. So I've definitely grown in the past year and I've been very grateful for that opportunity.
Any other questions from any students in the room? Yeah, Julian.
Hi, sorry, my camera is not working right now, but I had a couple questions for anyone on the panel who is applying to or is going to be enrolled in PA school. So I'm going to be a sophomore next year, and I was just kind of wondering what should like the timeline. I know that it's very like individualized to like however it's supposed to be for you, but if you have any suggestions on how I should maybe be able to start planning out my timeline for applying to PA school, doing research, and getting clinical opportunities, like that would be really helpful.
I would recommend starting your patient care hours and getting those as soon as possible. I didn't start getting them until after I graduated, so that's why I had to take a gap year or two gap years actually. But the earlier you start, the more prepared you are and the sooner you can apply. Obviously, there's no rush, but if you're wanting to get it to apply sooner, then start your hours as early as possible.
Hey Julian, it's Shelby. Ashley Foley, our pre-health advisor, has really awesome resources for our pre-PA, pre-med, pre-dental, pre all of the things. She, I believe, has a timeline, and it's, in a perfect world timeline of when you should start thinking about various things, when you should be applying, when you should be looking into patient care, when you should be looking into research. If you need help finding it, let me know. I could definitely pull those up, but it should be on her pre-health website as well.
All right, thank you guys very much.
I think one thing that's related slightly but on a different note is making sure that it's really early to start looking at schools and it might feel that way. But a lot of schools have a lot of different requirements between patient care hours, research, shadowing, what classes you have to take, specific grades you have to get. So as early as you can start looking at that and maybe have a few schools in mind. That way, you know that you're taking all the correct requirements, especially as a neuroscience major, depending on your track, you might have to go out of your way to do that. So it's something to definitely consider as well.
Thank you.
Any other questions? So maybe one thing that could be illuminating for the students is what's your work-life balance look like in your job? Like for example, Sarah Spini, I'm gonna put you on the spot. Like what's work-life balance for an EMT and like how sustainable is that?
So being an EMT is definitely an interesting job. The it depends on where you work. You can be working 12 hours, you can be working 24 hours, you can be working 10 hours. They're long shifts. Typically, you get an extra day or two off because the shifts are long. Um, it is difficult when you're working to kind of have that work-life balance. You might not get time to eat if you're having a rough day when it comes to calls. You might not always get the most sleep, so really prioritizing your schedule and being a good planner and organizer if you are trying to balance work and friends, and for me, applying to schools, scheduling myself out in advance and setting my goals and my timelines has been really helpful for me. If I set a time for or allocate a time for me to do something, I really try to stick to it and not brush it off. So that's a little advice. I mean, I honestly am probably not the best at balancing my work life, so it becomes a little bit of a difficult question. But I will say, given the patients that we work with and the populations that we're in and the emergencies that we see, talking to family, talking to people, and I'm sure this goes for all medical careers, taking that time for yourself and your mental health is super important. But yeah.
Anybody else want to jump in on this?
I agree. And I think it's important to have a good balance and see a routine that works for you. I worked almost full time my last semester of college, and it was definitely a lot. I overwhelmed myself and I got very stressed out at times. It was all worth it, but I do think that it made me develop a routine that worked better for me. It took some time. So I think just to give it your all, but also allow time for your head to be clear and to make sure that you're doing what's benefiting you, because at the end of the day you don't want to tire yourself out and make it difficult where you're not enjoying what you're doing anymore.
Back to Okay, I think we're coming up to on time. I know many of you have class afterward, but if you have more questions, I'm not seeing any, but hopefully you've learned a lot of things and you found this interesting. I hope our panelists will be happy also to maybe answer some questions offline if you have some questions that come up in the future. And obviously, we are all also here as your professors and mentors to help you with um, this journey you're on. So I want to thank everybody for coming. I want to thank all the panelists. It's good to see some of you who are students